it's true that there is a lot of anxiety in an IVF cycle, and we review a lot of medical records of patients who've taken IVF treatment in other clinics. And sometimes we find that patients have made the wrong decisions. And the reason they've made these wrong decisions, it was based on the wrong information. Why wrong information? Because often they've done these tests for themselves on unreliable laboratories, which will actually end up causing a lot of confusion, and they're not sure what the next steps are. And this is especially true for men who've done a semen analysis, for example, especially when the semen analysis is done in the IVF clinic itself. Now, you would expect that IVF clinics are experts and that the reports which they provide for semen analysis would be reliable. But the tragedy is it's not, because a lot of IVF clinics misreport deliberately a semen analysis report. And the reason they do this is because they want to convert people who actually don't have a medical problem into patients. Because once you've converted them into a patient, you can advise them to do IVF ICSI and therefore increase their revenue. And the commonest scam all these IVF clinics run is by reporting all the semen samples which come to them as having teratozoospermia. This is a bit of a mouthful, but teratozoospermia is just a fancy name for abnormal sperm morphology. And the tragedy is that these patients get labeled as having teratozoospermia even though their report is completely normal. And they keep on doing this. Not only do they create a lot of fear and anxiety, by all this misreporting, they create a lot of mistrust, because patients are not stupid. They understand that a scam is being run. And the right way to actually report sperm morphology is by providing a stain smear so that you can actually check how many sperms are abnormal. But these labs don't do this at all. They report everyone who comes to them as having teratozoospermia or less than 4% normal forms, which means the patient says, oh God, 96% or 97% of my sperms are abnormal. And then the doctor has the cheek to say, see, that's the reason you're not getting pregnant. I have made the diagnosis for you, and this is why you need to do IVF ICSI at my clinic. Please don't allow doctors to cheat you.